What is heavy implantation bleeding appearance?
Hello everyone, and welcome to today's video. In this video, we will be discussing the topic of heavy implantation bleeding appearance. Implantation bleeding is a phenomenon that occurs during early pregnancy, and it can sometimes cause concern when it is heavier than usual. Let's delve into this topic and understand what heavy implantation bleeding appearance entails.
What is implantation bleeding?
Before we discuss heavy implantation bleeding, let's first understand what implantation bleeding is. Implantation bleeding is a light spotting or discharge of blood that can occur when a fertilized egg attaches itself to the lining of the uterus. It usually happens around 6 to 12 days after conception and is considered one of the early signs of pregnancy. The bleeding is typically light and lasts for a short duration, ranging from a few hours to a couple of days.
Identifying heavy implantation bleeding.
Now, let's talk about heavy implantation bleeding appearance. Heavy implantation bleeding refers to a situation where the bleeding is more substantial than the usual light spotting associated with implantation. While heavy bleeding is not commonly associated with implantation, some women may experience it. When we talk about heavy implantation bleeding, we are referring to bleeding that resembles a regular menstrual period in terms of flow, duration, and the number of pads or tampons used. This can be concerning for women who are trying to conceive or are worried about the possibility of an early miscarriage.
Possible causes of heavy implantation bleeding.
Several factors can contribute to heavy implantation bleeding appearance. Let's explore some of the potential causes. Hormonal imbalances. In some cases, hormonal imbalances can lead to a heavier implantation bleeding. These imbalances can affect the thickness of the uterine lining and make it more prone to shedding during implantation, resulting in a heavier flow. Cervical irritation. During implantation, the cervix can become irritated or sensitive, leading to a heavier bleed. This can occur if the cervix is easily irritated or if there is an infection or inflammation present. Multiple embryos. In certain situations, such as when multiple embryos have implanted, the release of hormones can cause a heavier implantation bleed. Other factors, such as underlying medical conditions, hormonal medications, or certain procedures like in vitro fertilization, IVF, can also contribute to heavy implantation bleeding appearance. If you are experiencing heavy bleeding during early pregnancy, it is essential to consult with your healthcare provider to rule out any potential complications. To summarize, heavy implantation bleeding appearance is when the bleeding associated with implantation is heavier than usual and resembles a regular menstrual period in terms of flow, duration, and the number of pads or tampons used. While heavy bleeding is not common during implantation, it can occur due to hormonal imbalances, cervical irritation, multiple embryos, or other factors. If you are experiencing heavy implantation bleeding or are concerned about any bleeding during early pregnancy, it is always best to seek medical advice from your healthcare provider. They will be able to evaluate your specific situation and provide appropriate guidance and support. Thank you for watching today's video. If you found this information helpful, please consider subscribing to our channel for more pregnancy-related content. Take care, and we'll see you in the next video.